Good afternoon. This is Peter Thomas in Washington, D.C., General Counsel of the NAAOP. There are two issues that we would like to bring to your attention this month. One really involves a follow-up from last month's message about the Medicare O&P Improvement Act, and the other involves a new proposed regulation issued by the Office of Medicare Hearings and Appeals. First off, last month we asked you to contact your member of the Senate, both senators if you could, to try to get them to sponsor the Orthotic and Prosthetic Medicare Improvement Act. It's an important piece of legislation, S.829, sponsored by Senators Grassley and Senator Warren, bipartisan legislation that would really correct a lot of the problems with respect to Medicare, orthotics and prosthetics, coverage and reimbursement. For instance, counting the prosthetist and orthotist notes toward as being included in the patient's medical file for purposes of determining medical necessity, and several other important provisions. Well, in addition to sending a letter and contacting your Senate offices, we wanted to stress how important a time it is to try to get your senators or member of Congress to come visit you in your clinic and to bring them through a patient care experience, to demonstrate to them what orthotics and prosthetics is and the value of what you do for patient care. We encourage you to make those invitations in the month of August. Even in September, the Congress will be back in session after Labor Day for a few weeks, but then we'll be out again for almost all of October in preparation for the national elections. And it's a perfect opportunity to get their attention, to have them come visit you in your facility or in your clinic, and to show them in real terms the value of orthotics and prosthetics. We encourage you to do that, and if you need help in doing so, please contact NAAOP. The second thing we wanted to brief you on was a new proposed regulation issued by the Office of Medicare Hearings and Appeals, what they refer to as OMHA. Now, this is the federal agency located within the Department of Health and Human Services that administers the ALJs, the administrative law judges, and oversees all of the appeals that are at first denied by RACs and MACs and move up the chain, the internal administrative appeals process, through the redetermination process, the reconsideration process, and finally to the administrative law judge level. There are over 750,000 cases pending at the Office of Medicare Hearings and Appeals, and the office only has the capacity to process 77,000 appeals each year. Well, you don't have to be a rocket scientist to figure out that that's about a 10-year backlog that providers will be waiting for the disposition of their cases. And that's just simply unacceptable, especially when many of these cases that are now being denied are not even recoupments. They tend to be, more often than not, prepayment reviews, where a provider will actually provide the service or device and then ultimately never wind up getting paid and be put into a queue that lasts for years and years while they sit around and wait for their opportunity to be heard. It's a broken system and it needs to be changed. NAAOP has been working with the O&P Alliance and with many others to try to get the AFFIRM Act passed in the Senate, which would materially help. Now comes a new regulation that is designed to try to change some of the processes of the appeals process to try to make it more streamlined. But ultimately, it's a mixed bag for providers. For instance, one of the things that the regulation proposes is to eliminate the 90-day deadline for deciding appeals. Now, of course, this deadline is routinely violated. In fact, the average number of days it takes for the Office of Medicare Hearings and Appeals to decide a case is 832 days. So they're woefully deficient in meeting their statutory requirement. But nonetheless, that's a requirement that we're using to our advantage to try to press the federal government to do better. And by having a regulation that makes that permissive instead of a mandatory requirement is a major problem. There are a number of other provisions that are included in this proposed rule, including moving to Medicare attorneys rather than administrative law judges to examine some cases, making certain cases precedential, having the effect of law for downstream cases in the queue And if they choose to make precedential certain decisions, that could really compromise the rights of O&P providers and many other providers in the system. So NAOP, in addition to the O&P Alliance, will be working on comments, and will be submitting these comments by the end of the deadline being August 29th. We look forward to obtaining your input on this regulation, and hope you have a good month and a good summer. Thank you.